Hi, everybody. It's Dr. Laura Hanson with Connect My Brain. So glad that you're tuning in. I am starting a new series, and this one is called Case Studies, so that perhaps if we zero in on some detail, it helps especially parents understand where some children can really demonstrate some issues either with learning or emotions or what a lot of people call behavior. And what I'm going to do is I'm going to kind of unravel some stuff because I look at things from a developmental model. I look at it mechanically, chemically, and the brain. Mechanically has to do with how did this body get wired up? And that's really important because the body is imperative to give the feedback to the brain to move the brain forward. So when you come into this world, you are fully formed, but you are not fully functioning. So you think about a baby and what a baby does and all those milestone acquisitions that they go through, and literally they have a purpose. So what I'm hoping is that you will pick up some tidbits about milestone acquisition and compare it to what your child may have done or not done. For example, I use this example quite a bit. It is so important to crawl. It is so important to crawl on your hands and knees. But these bodies are marvelous in adapting. So I think of that little girl on the diaper commercial, and she's scooting on her bottom. And she's moving along. She's got movement, but it's an atypical movement. It's not the hands and knees. Now, she looks happy, right? But what we're missing with that is there is a change in how the wiring is going to respond by losing the whole upper body in that movement piece. When you're on your hands and knees, you're actually getting into the fingertips. You've actually got your hands on the ground with a slight arch to the hand. So for you just listening on a podcast, you can go hear this also on YouTube, is the hand, in order to write, needs this arch that is created during the crawling mechanism of hands and knees. So if I'm not using my upper body, then you can understand how it might impact a child's penmanship. And there's many other things, especially today, computers, keypads, etc., that we are really changing how the brain is intended to work with a pencil grip, and put it to the paper. And there's a very unique motor neuron. It's a unipolar neuron that is really dedicated to writing. And so if we're not using pens, pencils to paper, we're missing that particular feedback to the brain. And the other part that I always want to bring into the equation is we've all got everything the same in the brain, but it is the experience that wires us up. And especially from the component of the brain, mechanical chemical brain, we want to know what that experience was as far back as we possibly can, because it's going to really help us understand, how did this little person get wired up? How did you get wired up? I do talk a lot about pediatrics, and the majority of my practice is pediatrics, but I'm fascinated with it, not only to help the pediatric population that I serve and want to serve, but it also helps many adults understand a lot of things that they're going through. And I'll give examples as we go through the process of this series. But for now, mechanical is the movement piece. I want to look at that in my assessment. The brain, I'm going to really have a very detailed history. That's going to help me understand how things actually came together. What were the influences on the beginning of that developmental process, as well as a brain map, which allows us to literally look at the different bandwidths in the brain. So I did a series on neurofeedback, and you can always go back and listen to that. But we have brain waves. They're named delta for sleep, theta for subconscious imaginative play, precursor to sleep. Alpha is your focus, calm, the ability to sit in a mature way and learn, or to pay attention to whatever is going on. And then we have our low beta, which is a big part of the sensory motor strip of the brain. We've got beta, that's our executive function. We've got high beta. I will put into that category CEOs or high performance. However, if that's not your drive and you're in high beta a lot, that can lead to anxiety. Gamma is a binding wave. It binds a lot with theta. And remember, I was saying imagination, creativity, subconscious mind. When you have these gamma bursts, it's like the light bulb goes off and you're figuring something out. So all of these band waves or bandwidths, we can see what they're doing on a brain map. We can see the power behind them. We can see where is your brain relative to normative data or typical. So we're not saying we're comparing you to normal. We are comparing you to typical based on your age, your gender, and your handedness. So it's like funneling it down. And then we can also learn about the organization of the brain. So those different bandwidths that I was identifying, they're meant to be in particular regions of the brain when we're trying to isolate them out. Your bandwidths, your brain waves are all working together all the time, but they're supposed to come up in different cycles. So that's how we would look at somebody's brain. We can't read your thoughts, but we can see the power and the organization in that brain. And then the chemical part really has a lot to do with different things that may have happened, especially early on when a child is going through developmental windows. If that child's history is showing ear infections or different type of viruses or bacterias like strep, those are important for us to take a more detailed look at. They really relate to how things come together, especially in those first few years of life. And I'm going to explain these pieces as we move through cases. So rather than just sitting here and lecturing like we're in a class, I'm going to literally put it to a case so that you can understand and maybe find some comparisons. So I had a little boy come in, and let's see, he was about 10 years old at the time. And what I do when I look at the history is I'm trying to identify what is mama's concern. Mamas are so connected to their children. Nobody knows their children quite like mama does, okay? So we've got a 10-year-old with some generalized anxiety and some oppositional defiance disorder, ODD. Okay. He's been struggling since as far back as she can remember with behavior and regulating his emotions. He has trouble paying attention and occasionally has outbursts or has gotten in trouble for not keeping his hands to himself. He is such a bright boy, and I want him to be successful. So that's a typical mom right there. So when I start diving in, I've got a 10-year-old. Now, I want to put a place and time because I actually started seeing this little boy prior to the stuff that's been going on the last 2.5 years. Now, towards the end of his program is when everything was changing in our world. And at that time, we actually were cleaning things up, but we had to move into more of a virtual interaction. And it was okay because he is a very bright little boy. So he came in, he had an assessment. And some other things, though, before we dive into the assessment, and then I'm going to connect dots for you. Things that speak to me. This wasn't a planned pregnancy, and there wasn't a solid relationship between the parents going into this pregnancy. She breastfed for about 6 months, but the little guy had trouble latching. She would have trouble feeling like she couldn't breathe if she laid in particular postures while she was pregnant. She was on some medication for depression, but once she found out that she was pregnant, she stopped that. And let's see, there was an issue with her weight, and they wanted her to watch her weight during her pregnancy. She had about 5 to 7 ultrasounds during the pregnancy, and her prenatal vitamins were a prescription. Okay, I think that's the highlight. And then it goes into learning more about the different parts of the delivery. And then I'm going through the gross motor checklist, the fine motor, communication, adaptive skills, making sure that he went through all of those particular motor and fine motor and social communication, all of those different milestones, because that's the neurology being practiced. That's why whenever you're asked about developmental milestones, take your time and fill it out, because it really does provide an enormous amount of information. Okay, so top of the story is mom was in stress even when she got pregnant. And she was on medication during a particular window early on for that little baby coming together. And it was approximately, she didn't find out she was pregnant until she was about 6 to 7 weeks pregnant. Well, there's a lot of neurology that's already been laid down by that time. So this is why, in my opinion, I think it's a fabulous idea to plan to have a baby. That's number one. You can really look at yourself, your own health, and make sure that your body is prepared to have a baby. I mean, we make plans to go on a trip. We make plans to run a marathon and we train, but sometimes we don't plan to have these babies and things happen. One of the pieces of research that I read years ago, probably 20 some years ago, that really influenced my thought life was they were looking at what are some of the possibilities with the wave of autism from the 80s. So back in that time, what they found was that if you were over the age of 30, you were more likely to get a diagnosis of endocrine, autoimmune, diabetes, cancer, depression, and overweight. So those are the top 6 concerns. Well, but if you were under the age of 30, you were more likely not to get wired up correctly. So what does that mean? So when you get diagnosed with something, regardless of what it is, it didn't just happen the day before. Pathologies take time to break down something in the body before the symptoms get so high that it's going to match a particular diagnosis. Now, let's say that you are in your 30s at that time and you're in your childbearing years and you have subclinical findings. Well, that means that adding a pregnancy to a body that is already taxed sometimes can have a taxing effect on the baby as well. Then we start adding things. So I am moving my hands up like I'm layering, okay? So if we are not in perfect health, regardless if it is depression, diabetes, autoimmune, and then we're in a situation, we get pregnant, we add the stress of that situation, we are creating the perfect storm. And there is a lot that happens to a woman when she's in that kind of situation, that you're now talking about her chemistry and its impact on the life growing inside of her. Stress is a real issue. In fact, most of the things that actually go on outside of pregnancy and just in life really result from chronic stress, because these systems are marvelous. Even in listening to the categories for the milestones, which are fine motor, gross motor, social communication, and adaptation, we are designed to adapt. When we don't adapt, the bucket is turning over. And now it can create all kinds of problems. Do you know anybody, or has this ever happened to you, where all of a sudden, let's say you have this neck pain and you say, I was perfectly fine until. But if we go back and we look in that history, and I'm going to call it a bucket, there were all kinds of things that were going on in the past, meaning things that you have already moved through, but maybe didn't clear up completely in your body. And they were there. And then there is an event like maybe a slip and fall. And now that was it. It turned the bucket over. And now there's a cascade of problems that just don't seem to stop. This is a very common reaction with chronic stress. When we are in chronic stress, we are altering the blood from the front of the brain to the back of the brain. We are shifting blood away from the gastrointestinal system, liver, gallbladder, stomach, pancreas, spleen, adrenals, kidneys, bladder, uterus, genitourinary anatomy. So that's everything that's inside of the trunk, because the body is preparing to either fight or run. And, this happens at such a mild level that sometimes you don't even notice it. I often have people will say, I really know how to handle my stress. Great. We'll do a stress response test and it shows a completely different pattern. We're going to look at how your heart rate variability, body temperature, muscle tone, respiration. We're going to see how all of those things respond when you're actually under a stressful event. If it's a chronic pattern, we're going to see it. You're able to understand it. We even do it with our kiddos. But this is so important that we have to realize what was really going on for this mama, but maybe that was you too. And maybe you hear this and you're thinking about having a baby. One of the things that when I get the opportunity to meet pregnant mothers, the first thing that I say to them is the most important thing is that you are treated like a queen during your pregnancy. I just had a mom ask me, what is the one thing I could do every day to help my pregnancy go well? And I said, sit in a rocker, get a little vestibular stimulation, and talk to that baby. And all the things that you are dealing with, you tell the baby that you're handling it. The baby does not need to handle it. That baby just needs to be comfortable and warm and focused on its own growth. But you want to speak it, not just think it. You want to speak it. Speak it into the life that is growing inside of you. If you're not pregnant and would like to get pregnant, I'd love to help you plan your pregnancy. This is where you and your husband literally find out what's going on in your own body, in your own brain, get everything cleaned up, and then prepare to have a baby. That gives you the best opportunity to really have a healthy child and a much easier time than many people have gone through. So the stress part is incredibly important. Okay, so let's relate some other things to what we heard, the key areas of paying attention, some maybe, pushback type of personality or defense mechanism, and, having a hard time keeping his hands off of other children, things of that nature, as we go through the assessment part so you can connect more dots. So one of the things that we do here is we use interactive metronome. And we're going to use interactive metronome because it's a great way to look at the timing between both sides of the brain. Because when they're in front of the equipment, they're literally clapping. And they're clapping when they hear a bell. And their job is to clap with the bell, not before it and not after it. You're most accurate the lower your score is. So both hands, 45, that's exceptional. Left, right, so that's the cross crawl pattern, 55, that was very good. Right hand, left foot, 93, still under 100, but these are the kinds of things that get my attention because that's almost a 40-point difference between both sides, just paying attention. Balancing on the right foot, 40. Balancing on the left foot, 142. Now, do you see right hand, left foot for cross crawl, 93? Balance on the left foot, 142. There's a match there. Something's going on left side of the body, okay? Left side of the body is getting lots of feedback from the right side of the brain. The right side of your brain is your emotional quotient. The left side of your brain is your intellectual quotient. Right side is gross motor. Left side, fine motor. So there are things that happen from this cross crawl pattern from brain function to body, and how we might do something. The need to talk is on the right side. The work of talk is on the left side. So maybe having conversations is a little difficult for him. Maybe the way he is choosing to communicate is by going up and touching other children, because maybe there is a mismatch. Okay, let's move on. So then we look at timing through different body movements. So the one that really stuck out is a precursor to looking at a primitive reflex called asymmetrical tonic neck reflex. So you should be able to put one arm out and the opposite leg out. So that's the first instruction, just to see, can they follow that verbal cue? And then there's another exercise where they have to do an opposite arm and leg while they're laying on their back. In those situations, he actually used the same arm and same leg. So for this particular recording, this is what I want to really focus on so that I can leave you with some pretty solid information about the developing child, the developing brain, and how it has to work together in order for children to function. One of the things that is very frustrating to me is that children get labels put upon them, and it's put into this, quote, behavior, when we haven't really done a great job at looking at children before they go into school. Are they school ready? And right now, one of the biggest things for school ready is that you're potty trained. There's so much more to school readiness. In fact, a desire of my heart is I would love to be in all the schools, work with a team like me, and we are literally assessing these children like age 3 and 4, so that we can really know, have they matured into being ready to learn? Right now, with the things that are going on for this little guy, it's a battle between his lower brain and his higher brain. So it comes out as behavior, or viewed as behavior. But really, all he's doing is responding to the feedback that's in his own brain. So the asymmetric, before I even get into the AT and R, the one that precedes that, and in my opinion is like the enchilada, it's called the Moro reflex. This one is going to activate the arousal factor. It's also going to be the balance regulator of CO2 and O2 in the brain and body. It is also the beginning of the sympathetic nervous system, which this reflex comes on 9 weeks of pregnancy. So with all of the information that we started with regarding this pregnancy, there is the possibility that there's a lot of stress that went on. And in fact, it was difficult for mom. And this is one of the negative outcomes for babies whose mamas are so stressed out. Mama can rob cortisol from her baby through the umbilical cord to just help regulate herself enough, especially if she doesn't have enough. And that's another topic about how we actually make cortisol in our bodies. But just imagine if that is a possibility for the environment for the developing baby inside, which when we did the stress response on this little guy, he came out with a lot of chronic stress indicators. And the other thing that really drew me to him regarding the Moro reflex is his endurance was just not there. He has a very hard time trying to pay attention because his own system is so depleted because he's been in chronic stress for such a long time. This is a pattern that I am seeing in children a lot, is that we'll do an endurance test with them and they are not able to have their oxygen levels and their heart rates where they're supposed to be in a very short period of time. There's a 3-minute and a 5-minute, and you can see some very drastic drops. When a child doesn't have the energy to pay attention, when he doesn't have the energy inside of his brain to stay focused, there is no way he's going to be able to pay attention. Lots of times we can definitely see that there'll be imbalances between the theta brainwave, which is that precursor to sleep, and a rise in beta. So there is this fast wave and a slow wave basically fighting for the same space, and the brain doesn't really know who to pay attention to. That beta going up in a child is going to lead to anxiety in that child. A child does not know what to do with that much fast wave until their brain has actually reached a higher maturity level. So we're starting to understand, especially in children, that there's many factors that go on that play a part in the ability to pay attention. So it isn't that there is a lack of medication inside of them, but that there could be dysregulated brain waves. They could be fatigued. And when you're fatigued on a chronic level, you're not sleeping well. If you're not sleeping well, you're not recovering. So there's many factors that play into the ability to pay attention. Now, this ATNR also starts in the womb. And literally, for my podcast audience only, the little baby is in this flexed posture. The fists are very close to the body. The arms are very close to the body. The legs are very close to the body. But when the head turns, that arm and leg reach out. It is part of the birth process. So when the head is getting ready to be birthed, then the baby will get into that position, turn its head, move the arm out, which will help bring that shoulder underneath the pubic bone. And then the baby will come back to neutral and repeat the same movement to the other side. Now, initially then, this is for all of us, not just kids today. We all went through this. This reflex literally is going to split us right down the middle, making both sides have lateral columns of function. So if this reflex doesn't break up, it's hard for the communication to go back and forth between both sides of the brain. It's also part of near-far vision. When you come into this world, you see 2400. You are not getting closer to 2020 until about 10 weeks after birth. So that's also when some of these earlier reflexes are beginning to change their dominancy inside of the brainstem. and they're freeing up, integrating so that that baby can move on to the next step. So when I've got a 10-year-old who's still in a situation where his body should have fluidity and be able to move an opposite arm and leg in a rhythmic pattern, and he can't do it, he's got one side working over the other. So the right arm and leg are going to go out, and the left arm and leg are going to go out. And here's the big pearl. Children do not know how to tell you that their body is fighting them. They have no point of reference. No, hey, mom, did you know that when I go and try to write, my arm automatically just moves outward? They don't know that that is not what is expected. That is why a developmental screening is so vitally important for our children. There are so many things that are perfectly normal, but should have been integrated depending upon the child's age at different points in their lives. And if they didn't integrate, they are constantly interfering with that child moving forward. What was so great about working with this young man is it was through just the basic program that we could break up a lot of these reflexes. Lots of times, that's what we have to do, is we start with where the child is. And as soon as they gain some control over their body, then we can start really diving into the primitive reflexes. But he did. And then, unfortunately, we had the issues that went on in our world over the last couple of years. And we finished up the last part of the program virtually, which that part was kind of hard, but he still did quite well. And I was able to take him through some different abstract brain connectors that was going to take things that were really important to him, like his drawings. He really loved to draw. And when we take those drawing skills and put it into a cognitive process, he could begin to learn how his brain works and how he can take his strengths and the way his connections come together and apply it to the learning process. It was really a very fun case. So this is what I would like to do over the next, I don't know, probably a couple of months, because I have seen so many different kids that lots of times this is a big part of this practice is referral. People have come in here and then their child is going through something and they talk to a friend and a friend says, hey, I don't know if you remember when my child was going through that, or through something else, but I went over to connect my brain and it was different and we got through it. That's the passion of Connect My Brain. We want to paint the picture for you so that you understand and learn how to bring these pieces together once and for all. I believe in resolution. I've had many, many families come to me over the years who have tried many things. Many people bypass primitive reflexes, and these reflexes are there. And if they're not integrated, they will constantly trip this child up, and they can trip up you as well. They have to do with your ability to see and comprehend, pull the information together. It's your ability to have control over your body. It's your ability to make your brain do all the marvelous things that it's meant to do. Just to share one thing from, if you're an adult, and why would something like this even matter? There's a set of reflexes called the withdrawal reflexes that actually precede the primitive reflexes. And over our case series, you will definitely hear about that. But there are many adults today going through anxiety, having trouble leaving their home, not feeling grounded. And in fact, I was working with a woman and I really wanted her to think about doing some reflex training. And in order for me to demonstrate the power behind these reflexes, I came very, very close to her. And as I was walking in, I said, I'm going to come into your space. And literally, she pulled back so quickly. That's the withdrawal reflex. This reflex was designed in every one of us for survival. We all learned how to survive first. Then it's supposed to integrate. We're supposed to be comfortable in our environment. Now, I don't know how long it's been there for her. It could be there her whole life, or something may have happened, because you can have a very strong brain event, emotional event that can pull you right back into your brainstem and bring these reflexes back up, because they're the rudimentary place of all learning. The withdrawal reflex is meant for you to be able to interpret what may be a threat and then take you off of it. Think about when you're cooking. Have you ever skimmed your arm on a hot pot? What did you do? Well, you certainly didn't stand there and go, my arm is burning. You pulled it off without even thinking about it. That's the withdrawal reflexes. These reflexes are normal. They come in way before sensory motor. They're laying down the foundation and teaching the baby how to work in its environment, take the new information, build on it, and prepare the brain to move from brainstem to midbrain to higher brain. But these reflexes can come back, and perhaps something kept it from integrating. But it will constantly trip you up until you get that reflex integrated into the system and allow the higher brain to take over. In a child's world, that comes out as behavior. That's the way it is interpreted. And recently we just got so many scores back on our children that showed the impact of the last couple of years. Many children are going backwards and not going forward. So if that's your child, please call the office. Let us know. Let us just have a consultation. We can just talk about the situation, and I'll let you know if your case is a good fit and if I'm a good fit to serve your child. If you're an adult, perhaps you want to explore what's going on in your brain. That's where the neurofeedback comes in. You too can call the office, and we're happy to have a consultation with you as well. To the parents out there, on the website, connectmybrain.com, over under the podcast tab, there is a free downloadable Dr. Hansen's top developmental milestone chart. Please feel free to download it. There are so many ways to identify if our children are going in the right direction. The most important thing is to identify how far back do you need to go. Again, this is Dr. Laura Hansen with Connect My Brain. The office number is 678-501-5172. Thank you so much. Glad that you were here, and we will see you next time.